Study Section 7, Prenatal Development and Birth. Introduction. This study section presents a detailed overview of human development from the time the sperm is united with the ovum until birth. Prenatal development is divided into 3 trimesters. During the first 2 months, the developing human is referred to as an embryo. The embryo has 3 layers from which all body organs develop. During the second trimester, the developing human is referred to as a fetus. During the third trimester, the individual is a baby which, if born prematurely, could survive with extra support. Prenatal development. Learning outcomes. At the end of this study session, you should be able to 1. Identify various stages of prenatal development within the 9 months. 2. Identify the birthing or delivery process. 3. Describe various complications during the delivery process. In human development, a fetus, also called fetus, is a prenatal human between its embryonic state and its birth. The fetal stage of development tends to be taken as beginning at the gestational age of 11 weeks, that is, 9 weeks after fertilization. In biological terms, however, prenatal development is a continuum with no clear defining feature distinguishing an embryo from a fetus. The use of the term fetus generally implies that an embryo has developed to the point of being recognizable as a human. This is the point usually taken to be the 9th week after fertilization. A fetus is also characterized by the presence of all the major body organs, though they will not yet be fully developed and functional, and some not yet situated in their final anatomical location. Prenatal or antenatal development is the process in which a human embryo or fetus gestates during pregnancy from fertilization until birth. Often, the terms fetal development, or embryology are used in a similar sense. 1. 3 stages of prenatal physical development. First trimester. First month. Fertilization is the descent of ovum from the fallopian tube to the uterus. It entails early cell division and formation of embryonic disc from which new organism would develop. Early formation of 3 layers of cells. 1. The ectoderm, from which sense organs and nervous system will develop. 2. The mesoderm, from which circulatory, skeletal and muscular systems will develop, and endoderm, from which digestive and some glandular systems will develop. 3. Special layer of cells formed in the uterus which will become the placenta and through which nutritive substances will be carried to the new organism and waste product carried away. Special layer of cells forms the amnion or water sac which will surround the developing embryo except at umbilical cord. Heart tube forms and begins to pulsate and force blood to circulate through blood vessels in embryonic disc. Nervous system begins to arise, first in form of neural groove. Development of intestinal tract, lungs, liver, and kidneys begin. By end of 1 month, the embryo is about 1/4 inch long, curled into a crescent with small rubbings. Take 2. With small nubbins on sides of body indicating incipient arms and legs. Second month, embryo increases in size to about 1.5 inches. Bones and muscle begin to round out contours of body. Face and neck develop and begin to give features of a human being. Forehead is very prominent, reflecting precocious development of brain in comparison to the rest of the body. Limb bones elongate, muscles and cartilage develop, and sex organs begin to form. 3rd month. Beginning with the fertile period, sexual differentiation continues, with male sexual organs showing more rapid development and the female remaining more neutral. Birds for all 20 temporal teeth are laid down. Vocal cords appear, digestive system shows activity, stomach cells begin to secrete fluid, liver pours bile into intestine. Kidneys begin functioning, with urine gradually seeping into amniotic fluid. Other waste products are passed through placenta into mother's blood. Bones and muscles continue development, and by end of the 3rd month, spontaneous movement of arms, legs, shoulders, and fingers are possible. 2nd trimester. 4th month. Lower part of body show relatively accelerated rate, so that head size decreases from 1/2 to 1/4 of body size. Back straightens. Hands and feet are well formed. Skin appears dark red owing to coursing of blood, which shows through thin skin, and there are 1 wrinkles owing to absence of underlying fat. Finger closure is possible. Reflexes become more active as muscular maturation continues. Fetus begins to stir and so thrust out arms and legs in movements readily perceived by the mother. 5th month. Skin structures begin to attain finer form. Sweat and sebaceous glands are formed and they start functioning. Skin derivatives also appear here, nails on fingers and toes. Bony axis becomes quite straight and much spontaneous activity occurs. Fetus is lean and wrinkled, about 1 foot long and weighs about 1 pound. 6th month. Eyelids, which have been focused shut since 3rd month, reopen. Eyes are completely formed. Taste buds appear on tongue and in mouth and are in fact more abundant than in the infant or adult. 3rd trimester. 7th month. Organism is capable of independent life from this time on. Cerebral hemispheres cover almost the entire brain. 7-month fetus can emit a variety of specialized responses. Generally, it is about 15 inches long and weighs about 3 pounds. 8th and 9th month. During this time, finishing touches are being put on the various organs and functional capacities. Fat is formed rapidly over the entire body, smoothing out the wrinkled skin and rounding out body contours. Dull red color of skin fades so that a fair pigmentation of skin is usually very slight in all races. Activity is usually great and it can change its position within a somewhat crowded uterus. Periods of activity will alternate with periods of quiescence. Fertile organs step up their activity. Fertile heart rate becomes quite rapid. Digestive organs continue to expel more waste product, leading to the formation of a fertile stool called the meconium, which is expelled shortly after birth. Violent uterine contractions begin, though milder ones have been tolerated earlier, and the fetus is eventually expelled from the womb into an independent physiological existence. The time leading up to the normal birthing process is generally 266 days, 38 weeks, from conception to birth. However, only about 5% of births occur on the actual due date. 1. The 4 stages of labor. Stage 1. From the outset of labor to full cervix dilation. Stage 2. From full cervix dilation to delivery of baby. Stage 3. From delivery of baby to expulsion of placenta. Stage 4. From expulsion of placenta to afterbirth recovery. Stage 1. Labor outset to full cervix dilation. Stage 1 consists of regular uterine contractions with cervix dilation. Full cervix dilation occurs at approximately 4 inches. The length of this stage varies from one mother to another. It depends on many factors, including but not limited to previous pregnancies, the health and condition of the mother and fetus, patience of the doctor or midwife, and willingness to induce labor, medications used at this stage, hospital versus home birth, etc. Stage 2. Full cervix dilation to delivery of baby. Stage 2 generally takes from 15 to 50 minutes. During this time, uterine contractions strengthen and become more frequent. During this stage, mother will feel the need to bear down and push. The baby goes through a series of passive movements, especially the head, which undergoes flexion, internal rotation, extension, external rotation, and crowning, the first sign of the baby's head. Stage 3. Delivery of baby to expulsion of placenta. This stage consists of the period immediately following birth to the expulsion of the placenta. This generally takes 5 to 10 minutes. Should the placenta fail to come out easily, tugging or pulling should not be performed. Gentle uterine massage may be utilized to assist in the release. The placenta should always be examined to be sure no part remains within the uterus. This can become detrimental to the mother, causing hemorrhage and/or death. Stage 4. Expulsion of placenta to afterbirth recovery. During this stage, mother is monitored to be sure no uterine bleeding or other complications occur. Complications during the birthing process. The following are the complications which occur during the birthing process. 1. Insufficient power. Sufficient power and coordinated contractions are essential for a smooth, uncomplicated labor. When the power of the contractions is weak, or the pattern of contractions reorganized, the mother is more likely to become exhausted. This can cause fetal distress resulting in fetal harm and/or C-section. The following are causes of insufficient power or improper contractions. A. Disordered uterine action. B. Colicky uterus. C. Constriction ring, Bandis ring. D. Rigid cervix, edematous cervix, and annular detachment. 2. Passage obstruction. Passageway obstructions, pelvic, uterine, cervix, etc. can complicate the birthing process. These include A. Tumors. B. Cysts. C. Fractures. D. Subluxations. E. Flat male-like pelvis android. F. Physiological changes, degenerative joint disease, tuberculosis, rickets, osteomalacia. 3. Baby malposition. Malposition of the fetus can lead to abnormal birth presentations. Some of the more common malposition birth presentations include 4. Upside-down presentation. This presentation occurs in approximately 13% of births and involves a presentation where the baby presents itself in an upside-down or sunny-side-up position. If the baby does not turn to the proper position or turns late, the newborn will generally develop cone head. This position also produces what is known as back labor. This can be significantly reduced in women who receive regular chiropractic care during their pregnancy. 5. Breech presentation. In a breech presentation, the feet or buttocks present first as opposed to the head. This presentation occurs in about 1 out of every 40 births. Possible complications can be serious and include 1. Intracranial bleeding. 2. Neck dislocation. 3. shoulder dislocation. 4. Hip dislocation. 5. Clavicle fracture. 6. Internal organ disruption. 7. Genital edema. 8. Premature placental rupture. 9. Prolapsed cord. 10. Uterine rupture. 6. Phase presentation. Phase presentation occurs approximately every 3,000 births. In this presentation, the baby presents phase first with the neck in extension. Causes include a lax uterus, flat pelvis, and multiple fetuses, anencephaly or neck spasm of the fetus. This is stressful on the cervical spine and usually results in a cervical subluxation in the newborn. Chiropractic care by a chiropractor trained in adjusting newborns is crucial for the continued proper growth of the spine. 7. Shoulder presentation. The shoulder presentation occurs in every 200 to 300 births and involves a shoulder-first delivery. The causes include 1. Twin birth. 2. Adramnios, excess of amniotic fluid. 3. Placenta previa. Part of the uterus present before the fetus due to placenta malposition. 4. Multiparty. Women who have had 3 or more children. 5. Subseptate uterus. 6. Unusual fetal shape. 7. Undue mobility of the pelvis. 8. Forceps delivery. In the event of fetal or mother distress or the labor is not going as planned, forceps assistance may be used. As forceps can cause a number of problems, forceps should only be used in absolutely necessary situations. The following injuries can result from inappropriate forceps use. 1. Skull fractures. 2. Birthmarks. 3. Doctor-induced torticollis. 4. Branchial plexus damage. 9. Cesarean section. Although C-sections were becoming very popular a short while back, experts now recommend avoiding this procedure unless the mother or fetus are in extreme distress. This is due to the invasiveness of the procedure and unnecessary stresses placed on the baby. The indications for cesareans are 1. Placenta previa. Part of the uterus presents before the fetus due to placenta malposition. 2. Fetal distress. 3. Maternal distress. 4. Failure for labor to progress. Summary of Study Section 7. At the end of this study session, you have learned about 1. Prenatal development. 2. The birthing process. 3. Complications during the birthing process. This is the end of Study Section 7. Thanks for listening.